Hey guys, what's up? So I'm back with clinical update number 4. Decided to take a break away from my studying and all that because I do have two exams on Monday actually. One fundamentals exam and my sociology of the family midterm is due on Monday. But break time, video time. I told you guys, I'm definitely gonna try and get these clinical updates out every week. Makes no sense to do it two in 1 week, So yeah, here I am. Anyway, it's past Wednesday. Went to clinical, we pre-conference with my professor, and basically what we found out is, we were doing hygiene that day, as well as assessment of the skin, hair and nails, and just anything else that we have already learned. So ambulating a patient, from bed to chair to bathroom, whatever the case may be, turning them, all that good stuff. So got my patient, went into her room, checked up on her, and she was an 81-year-old woman. She had just had a stroke last month, and she actually came into the hospital. Her diagnosis was congestive heart failure. What she told me was that she was in her rehabilitation center, and she started throwing up, and she was just throwing up uncontrollably vomiting, and after a while, she couldn't breathe. So that's what happened. She couldn't breathe, and she's telling them, I need to go, whatever. Somehow they got the situation stabilized and brought her into the hospital. And that's how she ended up in my good graces. So yeah, I go in there. She's having breakfast. So, I identified and introduced myself to her, let her know what was going to be happening that day, that I'd be with her for the day. And, I left her alone so she could finish eating her breakfast. Went, checked the Cardex, all that good stuff. Got what I would need to give her a bed bath and change her linens. And take her vital signs, came back to the room. Now, what she told me was that she needed to use the bathroom. Okay, cool. Now, she still has left-sided weakness from the stroke that she had last month, but she had started to ambulate in the rehabilitation center that she was in. So, she could ambulate with a walker and assistance. Now, I was going to help her ambulate to the bathroom, but she really had to go. Like, really, really had to go. There was no way we was getting her off the bed, dangling her, getting her to the walker and to the bathroom in time. Just wasn't gonna happen. So got the bedpan for her. Now I get her on the bedpan, and she starts to it was like a grunt, sigh of relief, something to that extent. And I realized she's easing her bowels. She was making a BM, and I know that that's what she was going to be doing. She told me she had to use the bathroom. I thought she had to pee. No. She did not have to urinate. She needed to make a bowel movement. And the aroma that filled the room. Goodness gracious. Now, I'm very good when I'm placed in situations, especially ones like this. Like let's say I'm on a job at work. You're not going to see if I'm uncomfortable or in pain. I could be sick as a dog. When I get on the floor, nobody's going to know it. Same goes for my patient. She did not know that the odor that was filling my nostrils at that moment was enough to make me pass out. She didn't know it. And my professor walked into the room, and I didn't realize she was in there at first because, the curtains are drawn, provided privacy, of course. And she asked me if I'm okay. I said, yeah, I'm okay. It's funny because later on that day, my patient made another movement, and my professor's like, there is something not right about the way her movements are smelling. And it was her and the patient in the bed next to her. Like, I don't know, something's in the food in that hospital. I don't know. Anyway, she finished making her movement, and I mean, this was probably a stupid question on my part. I do admit it. I asked her if, if she needed me to clean her up or if she wanted to do it herself. Now, my rationale behind this was that not everyone feels comfortable with somebody else wiping their backside or their front side unless they really can't do it themselves, So I was giving her the option. I felt that was the right thing. I still feel like it's the right thing, but, she responded, no, I think you better do it this time. I was like, okay, no problem. So I'm cleaning her and wiping her up, and the movement was so large, and it wasn't a firm, hard stool. It wasn't the straight diarrhea either. It was soft, but it had a, a consistency where it was together. It was just mushy. So that took forever to clean up because she has a very large rear end. Anyway, got it cleaned up. Brought the bedpan in the bathroom, washed that out, did all that good stuff. And I said, so, we're gonna take your bath now. I said, I figure you wanna, get washed up and cleaned up. And started to wash her up. Now, she wasn't a total care because she was able to, wash her arms. She washed her breast herself. She washed her perineal area by herself. All I really had to do, she washed her face, brushed her teeth, all that good stuff on her own. So that was good. What all I had to do really was wash her legs and her feet and her back side, of course. Her back, her buttocks, and all that area, all that good stuff. So that's what I did. And while I'm doing this, I'm assessing her skin. And she also had macular degeneration. And, I saw it on the Cardex, but seeing it on her was a whole other story. She had the macules on her butt cheeks, the back of her neck, her arms. It was like all over the place. She had lots of freckles. She didn't have any ulcers, but she did have a few. I would personally consider it stage 1 ulcers due to like IV placement in her arm because they were trying to find the veins in her arm, but they tore the poor lady's arm up. Oh my gosh, I felt so bad because they stuck it. They let me get my arm. They like stuck it here. They couldn't get anything, so stuck it down here, and then they stuck it down here, and then in each spot that they stuck the IV in, it's just a red spot about this big would pop up. And I mean, she said it always happens whenever she gets IVs put into her veins, regardless. She said she said she's just black and blue after, and then everything gets fixed up. So I know she would be fine. But that was just ugh to me. She also had a skin graft on her right arm, so that was there. Her hair was fine. She didn't have thinning hair. She had hair for an 81-year-old woman. That's the way I see it. It wasn't a full head, but it wasn't a thin, wispy. Oh my gosh, all your hair is going bye bye. Wasn't that bad. She had her toes. She had like diabetic feet. Her toenails were kind of hard and brittle and like she didn't have any she didn't have calluses on her heels or anything, but her toenails were very hard and brittle in the area, the lining around her toenails. So yeah. What else? She had a couple moles. What else? Oh, her skin turgor was very poor. Like, she had very poor skin turgor. So that would explain why when they tried to place the IV and they kept not being able to get the vein, it left such large marks on her skin because her skin is very soft and flabby. It wasn't like paper thin in the sense of, oh my God, if I scratch my nail against her, it's just all over. But it was flabby. It was hanging. I don't know. My skin. My arms don't exactly hang. They used to though. But yeah, they don't hang that much. But her skin turgor was very poor and she did have tenting. So that explained all the other skin problems with her, I guess. Her fingernails were fine though. Her fingernails were regular. Thought that was kind of, I didn't want to say it was weird, but I thought, toenails, fingernails, they might kind of coincide. I mean, correlate. Not really though. But it was cool. So after her bed bath, I moved her from the bed to the chair with the walker. And I felt really good about that because honestly, I said, so, you ready to get up and go to the chair? And she's like, I don't think I can. And the lady in the bed next to her now was older than her, but she's just walking in and out. She needed a walker to walk, but once she got that walker, she was out like a light, just speeding through. I'd have been scared of her if I was on the highway. And it kind of was not intimidating, but it made my patient more self-conscious about her own abilities on the walker. And I just kept reminding her, everybody recuperates at their own pace. and we're gonna do this. I said, come on, let's at least try. And she was willing to try. And I felt so good that I was able to get her from the bed to the chair. And she felt good to be sitting up and not laying in the bed. Like, she really felt better about herself. She was watching TV, you know, she was I helped her do her lunch and dinner menu there. Left her there for a little bit. Went and, you know, I took care of something for my one of my classmates because her patient was going off the floor. So my professor had asked me to just make up that patient's bed and clear their room out for a little bit while my friend went with her. Came back and we were just talking. You know, I did her vital signs and everything, and she felt so good to be out of the bed. Now, after that, what happened? Right, my friend, my classmate, she came back with her patient, and we had to give her a bath. Because the way everyone in the class felt more comfortable doing it in pairs, you know, so it was like, okay, you have your patient, I have my patient, but we're going to help each other out. I never did receive help with my patient, but it was cool. So I went to go help my partner, classmate, with her patient, and that woman, she had also had a stroke, if I'm not mistaken. I don't exactly know fully what happened to her. That's bad on my part. I should have, you know, asked more questions. But again, she wasn't even on the floor that long. She had to keep going out for tests and whatnot. We made her bed and gave her, she was a complete bath. She really just laid there. Like, you could tell she was very sad. You could tell she was just so sad and depressed. She could not do anything for herself. And that was fine. You know, we cleaned her up and I was consoling her and, you know, making sure she was comfortable while my friend, you know, washed her up and everything. And I was just there to help out. Okay, after we had finished with her, I went back to my patient now. And she needed to go to the bathroom again. So this time she's in the chair. Brought her from the chair to the bathroom with her IV pole and the walker. And we're walking to the bathroom, and I look down and I see a little plop of brown on the floor. YouTube, I was just like, you gotta be kidding me right now. This is not life. So get her in the bathroom, and there's another plop on the tiles. I said, Jesus, Lord, help me get through this one. Now, at that point, all I remembered was when feces falls on the floor, you clean it with the solution that is 10% bleach. Now, I'm thinking, where am I going to get 10% bleach to clean this up off the floor? Whatever. While my patient was in the bathroom doing her thing, I went and found one of the nursing assistants, and I asked her, you know, I let her know what happened. I asked her what to do. She told me to just wipe it up and that they would have one of the service people come in and mop it up. I said, okay, cool. So I did that, wiped it up. When my patient was done using the bathroom, brought her out, and, you know, I had to cover the feces with tissue first because my patient was in the bathroom, the gloves was in the bathroom, and the toilet was in the bathroom, and it was just ridiculous. Anyway, got her out the bathroom safely and everything. Got her, she didn't want to go back to the chair at this point. She was really tired. She went back to the bed. Got her into bed. The patient in the bed next to her, that lady's daughter, she said, my mother needs to use the bathroom. Come on, my mom needs to use the bathroom. She really needs to go. And I'm thinking to myself, this is not my patient. But, like, you know, I didn't want to get in trouble. God forbid something went wrong. But I felt confident in my own abilities. I was like, you know what? Got you. Ambulated her mom to the bathroom. This is after I cleaned the feces up off the floor. Let her mom sit in there, use the bathroom and everything. The lady was good. When I brought her out the bathroom, there was feces all over the seat. And she had feces tissue on the floor. And I'm thinking to myself, oh my God. Today was just a feces poop filled day for me. That's all I could say. And all of this smelled the same way. Anyway, I cleaned up after this lady now. I told the nursing assistant again. I'm like, this time it's double trouble. You know, like, we really got to get this cleaned up soon. Mopped up anyway. And then my professor comes in like a guardian angel and says, it's time to go. I was like, hallelujah. Today was a good day, but I am free. Goodbye, sayonara, later. And that was how my clinical day went this past Wednesday, YouTube. So, Again, thanks for watching. Like, comment, subscribe. If you have any questions, hit me up as always. Hope this week's story was interesting for you. And if you have any questions on dealing with feces, I think I might just be a pro at it now, or pretty damn knowledgeable at this point. So just hit me up and ask, okay? Later, guys.